Hi everyone, this is Professor Aloy and I'm here to give you a brief orientation before we actually have our orientation for clinical. So the first thing I'd like to say is this is a page or a site that I've set up for a group, and I will be communicating with you via this website. So let's get started here. So the first thing I want to orient you to is my contact information here. So at clinical or even outside of clinical, if you need to get in touch with me, please put my cell phone number in your phone. If you have any emergencies, absences, any kind of communicating you need to do with me during clinical, please send me a text message or call me. For emails or any other kind of communication, please use my Pierce College email. Prior to us starting clinical, I'd like for you to complete a student self-assessment, and this will just help me get a better idea in terms of what your strengths and weaknesses are. I'm going to click here and take you to the form. This is something just for you and me to see, and this will help me know what areas in which I need to work with you in clinical and maybe add different learning activities. I'd like for you to complete this for me by the 31st of August. So that's our orientation day, or actually that's our first clinical day, and that way when we get started, I'll have all this information. So please come here, fill this out. It should just take you a couple minutes. Okay, so getting here, this is just every week I'm going to update this page. So for our week 1, we're going to have our orientation. This is going to be next Thursday. I can't believe our summer is over. August 30th. We'll be meeting at 7:30 in the Education Center at Olive View Medical Center. I will try to get you a map. But it's in what we call the bowl. We can talk class on the 28th about this a little bit, but it's not at the hospital. It's a little bit before the hospital, and I will look for a map for you. On Friday, our first clinical day, the 31st, we will be meeting as a group in the cafeteria at 6:30. Please be on time. On Friday, you're going to be caring for one patient. So please come, as I say here, come prepared with your ORCID sign-on, which we should be getting on Thursday, your organizational tool and lab worksheets, which we'll talk about in a few minutes, your drug reference, either a physical drug reference book or if you have a resource on your phone. I'd like for you to bring your skills reference book. If you have the resource on your phone through the point, that's fine with me. And of course, bring a great attitude, which I know each and every of you will bring with you. Also, of course, your stethoscope, pen light, scissors, and any other supplies that you might need for clinical. They do have a very, very nice cafeteria with a grill, and the units do have refrigerators. So if you want to bring your lunch, there's refrigerators. Otherwise, they've got good food there. So I've created our clinical schedule. So I want to talk a little bit about this schedule here. So this is our clinical schedule, and so as you can see here, it's a lot of information. We'll have our orientation on the 30th, and then we'll get started on the 31st. We're on 2 units, which is 4A and 4D. It's medical surgical units. 4A is more surgical patients, 4D are more med-surg patients. What we're going to do is halfway through our clinical, we're going to switch. So as you can see here, Reza is going to be 4D, then halfway through he's going to switch to 4A. And I'm doing that so you can get a feel for both types of units and both types of patient populations. You're going to be going to the OR, and that's going to be your out rotation, and then you'll have med passes. Down below here are our care plan, due dates, and then we're also going to have a teaching care plan, and during these dates in post-conference we're going to be having clinical post-conference, and we'll also be going to have presentations for your teaching care plans. So please print this out, have this somewhere so you know where you'll be going. If you find any errors, please let me know. And yeah, okay, so let's move on. Okay, so after we've looked at the clinical, I want to talk to you about choosing your patients. So I am of the mind that I want you to choose your own patients. I want you to choose challenging patients in which you are going to learn something from. I know everyone wants to just fly under the radar. Please, for your clinical, I want you guys to learn and experience as much as you can. So I do not want you choosing a specific nurse and following her assignment. I want you to go in. I want you to get on the computer. I want you to looking for etiologies of things that we're covering, things that you need to be learning and growing with. So we'll talk about this more in clinical. I'll be working with you. Please choose challenging, robust patients. And all of you, so I know you've seen before the 6 rights. The 8 rights is now becoming the standard of practice. So please have the 8 rights somewhere on your clipboard. This is something that we will be going over every time we're passing meds, and we will be discussing the right patient, the right medication, the right dosage, the right route, the right time, the right reason, the right response, and the right documentation. So this is something that all of you requires, and this is something I will require you to have on your clipboard and have a discussion with me when we're passing meds. Going down here, these are all resources that I need you all to go through, print out, and have either in your notebooks, your clipboard, like clinical. So assessment basics on our skills day, I had a copy of this form. This is something that I'd like for you to have on your clipboard. So as you're giving me head to toe report, you can stay focused from head to toe. And as you can see here, I have it organized from head to toe: neurological, cardiovascular, respiratory, eyes, ears, nose, and throat, GI, GU, musculoskeletal, integument, and psychosocial. Additionally, you also need to know where your patient's IV is, where the IV is, when it was submitted, and whether it's a peripheral or a central line. ORCID charting guidelines. So I'd like for you to review this. These are my expectations for your charting. So I have some stuff here to for you to review. Please bring a copy of this, and we'll talk about it more at clinical on our orientation day. Lab values and med sheets. Talk about that in a minute. Your scavenger hunt. I'd like for you to bring this. We're going to be doing the scavenger hunt on our orientation day. Please bring a copy. I will not have a copy for you, so you need to bring this to clinical orientation. And clinical paperwork. So this is the paperwork that you will be using at clinical. So I'd like to go over this with you as soon as it opens. Okay, so clinical paperwork. So I have this. There are 3 lines here because by the end of the rotation, you're going to be caring for 3 patients. So line 1, this is patient 1, patient 2, patient 3. And you know, I recommend when you're getting a report, you use a pencil, you fill out as much as you can, and then as you're going through, you fill in the blanks after you've assessed your patient, looked up more information in the chart, and so on and so forth. This is still all for the same patient. I apologize that some of it's saved. It uploaded kind of wonky. I can try to get you a better copy. But what I really like about the second page here is that you can have a place where you can mark where the IV is, where there's any skin issues, anything to help you in terms of your assessment and your documentation. And moving on, this area is your time grid. So here you're going to document, like if you have 7 o'clock meds or you've got blood pressures, whatever it is to do, this is going to help you be organized. So that is your organizational tool. What I'd like for you to do is print, try to print these front and back so you don't have a lot of papers on your clipboard. This needs to be on your clipboard at all times. This is your lab range. What I suggest you do is have a lab reference so you can quickly know what the significant, high, low, so on and so forth. What I like here is you can put a range of lab dates. If your patient has been in the hospital for more than 1 day, I'd like to see a range. This is our medication sheet. So this allergies, some medication teaching to help you teach your patient. And if you recall in our skills day, I talked a little bit about this. Remember, this needs to be completed in its entirety. Trade name, generic name, those, as long as you have one of the names, but remember, I want the medical and the pharmacological classification. If it's an antibiotic, please don't tell me it's an antibiotic or an anti-infective. I need to know the classification. Same thing with like a blood pressure medication. Don't tell me it's a antihypertensive. I want to know it's a beta blocker, ACE inhibitor. You need to dig deeper. I need more information. So you need dose, route, frequency, safe range, very important, and all this information here. In terms of nursing implication, expected outcome and evaluation. Nursing implications, we're going to be talking about that. And when we're discussing your patient prior to passing meds. So for example, if we're giving insulin, I want you to know the signs and symptoms of hyper and hypoglycemia. Each medication is case by case, but I want you to have enough information to safely medicate your patient. This last part is a situational assessment. You may have seen this in some way, shape, or form in first semester. You will be seeing it each semester here at Pierce College. And this is something that when you walk in the room during the first thing that you're going to be doing is completing your situational assessment. It's for you to assess the patient, assess the area, and it's going to help you identify if there's any needs or safety or anything going on with your patient. I'll talk to you about this more in depth in our orientation, but you need to turn this in to me every day by 10 o'clock. So this is your clinical paperwork. It is somewhat involved, but this needs to be on your paperwork every day, every patient. Okay, so care planning. So we're going to have 3 care plans in addition to the teaching care plan. Your first care plan will be due on September 14th, second September 7th, and the last one October 5th. And then you will have a teaching care plan, and I do have the files here for both of these, so you can take a look at those and ask questions. And we'll talk about that more in our orientation. Here's some other assessment and other informational thing. This is a Virtuous head-to-toe assessment tool that I shared in our skills day, and I'm trying to open it here for you. This is something that, as I said in our skills day, this is not, I do not want you to be using this on assessing your each patient. This is a tool to help you in terms of filling in the gaps in your assessment skills and helping you in your documentation so you know exactly what you're going to be documenting. Oftentimes, you're not sure what to document, and this is an excellent tool that will help you. So as I said, please, this is not to take into the room and use on your head to toe. You'll never get finished. This is a tool to help you fill in the blanks and as just an educational or informational tool. Okay, so this is not what I thought it was, but let's go down to the very bottom, and this is where you're going to find math. So disregard, there we go. The care plan that you're seeing up here, that is not the current care plan. So from here, so starting at Little Company of Mary and down is appropriate, anything above is not. Okay, let's go back now. I have your clinical evaluation tool. I'm not going to open it up, but please print that out. You will be giving me a copy, and I will have you do a self-assessment, more to talk about that. This is the oxygen therapy I'll open it here. This gives you different modalities of oxygenation. This is a really, really good tool. Please have a copy of it somewhere on clinical. I may ask you one day, if you have a patient on a nasal cannula, how many liters? How many liters can you have in a maximum amount of nasal cannula? You're going to know that it's 6 liters. You're going to know that if you're putting a patient on a simple mask, that you're going to use 6 to 10 liters, and you're going to know, in partial and non-rebreather, that you need to use between 8 and 12 or 10 and 15 liters. So this is really a great tool that you should copy and keep with you when you're in nursing school and even beyond if you ever have a question, because oxygen is a medication, it's a drug, and if you don't use it safely, you can hurt your patient. So that's another really good tool for you. Okay, so let's talk about our out rotation. So unfortunately, we have an uneven number of students. So I like to send students in groups of 2, but unfortunately, because I only have 7 students, so I have 1 student that is going alone. With that being said, it seems like the OR has been changing their policies and they really don't want the students staying together in the OR. So if that's the case, just please, whatever the OR asks you to do, you're right. So on your out rotation day, you go to the OR 2 days. So on that day, for Thursday, you're going to arrive at 6:30 in the morning. You can come to the unit and help out with vitals or whatever you might need to do in the unit. You're going to go at 7:30. You're going to go down to the 3rd floor. And these are the instructions. I will give you the code to the OR in person. I just didn't want to put that out on the World Wide Web. So we'll talk more about this, but you'll be going down there. The first day, you'll be going to different surgeries, and then the second day, you'll be following a patient from start to finish, and then you can choose what you want to do. Anyway, just there's some information there. I'll talk with you more about that. And I apologize, I just don't think I can send 3 students to the OR at the same time. So, all right, let's see what else I've got here. So clinical skills, as I said earlier, I'd like for you to have either your skills reference book or the app on your phone. The reason this is so important to me is I understand that there's lots of skills and lots of things that you haven't done, and any opportunity, I want to make sure you get the opportunity to complete any skill, but I want you to review the skill first. So, if you have an option to do a Foley, injections, whatever, like anything that you're going to be doing that you're rusty on, you're not sure, before you come to me and say, Professor Loy, what do I do? How do I do it? I want you to look in your book, review the steps, and then I want to meet with you, and then we'll discuss it, we'll practice, and then we'll go in the patient's room and do it. So please, it's very important, have that with you. So sometimes students aren't sure about patient care. What is total patient care? So to me, for your instructor, total patient care means that you will complete a focused full head-to-toe assessment. You will round on your 1, 2, and 3 patients every hour and meet whatever needs they have. You will help them complete their activities of daily living. This may be a bed bath if your patient is unable to do so. Oral care. Oral care is so very important. There's nothing worse than coming into a patient's room and seeing gunk in their mouths and dirty teeth. And please brush your patient's teeth, help them, make them feel comfortable. Linen changes. Patients' linen should be changed every day. How would you want to be laying on a dirty bed? Linen changes, tidying the patient's room, feeding patients, repositioning. If you have an immobile patient, every 2 hours, you need to be repositioning your patient because they are at risk for skin breakdown and anything else they may need. Please gently inform the CNAs that you're responsible for total patient care, and that also includes vitals. Now, sometimes the CNAs get there early and do the 8 o'clocks, but it's, if they've done them before you get there, There's nothing we can do about it. It's my expectation you're doing 8 and 12 vitals. Please gently let the CNA know that that's what you're going to be doing, and that in which patient you're going to be caring for. Also, please follow this page. This one says stop following because I followed it. It's going to give you an option to follow it. Follow the page so that way every time I update you'll see it, and I'll update this every week. So please go through everything, print out the stuff you need. If you have questions, let me know. I'm really looking forward to seeing y'all next week, and have a great day.